Johnson, Commissioner of Health with the Milwaukee Health Department. Thank you all for being here. And Mayor Barrett, I'll hand it over to you to get us started.
Well, thank you very much, Catherine, and good afternoon, everyone. We'll start as we usually do with an update on our COVID-19 gating metrics. And unfortunately, I don't like being in this category, but we remain in the extreme transmission category for COVID cases per 100,000. We're up to 353 per 100,000. Last week, we were at 237.1 per 100,000. So this is a significant increase just in the last week. Our percent positivity rate remains in the substantial transmission category at 9.4%. Our vaccination numbers are not moving at the pace I would like to see them run at. We're at 55.3% of adults who are fully vaccinated, and 61% of adults have received at least one dose. We have also seen testing volumes increase dramatically in the past 2 weeks. The numbers are comparable to the number of weekly tests performed in late October 2020 prior to our fall peak in case numbers. And so we have to say this over and over again, and I know we're beating the drum over and over again, how important it is to get vaccinated and to follow the safety precautions so we can protect everyone. As I mentioned last week, Saturday, so just several days from now, Saturday, September 25th, will be the final day for testing at the American Family Field through our partnership with the Brewers. The Brewers have been fabulous partners throughout this, but as they come near the end of their regular season, they are gearing up for what I'm hoping will be a world championship. So they're going to be focusing on making sure that their stadium and all the parking is available for that. So we are still working through the details of this change, and we will be sharing the information on the new location later this week. So that will become available as soon as it is available. The Milwaukee Health Department continues to offer free and readily accessible vaccinations across the community in a wide range of settings, as you can see on the screen. Here's one win. Last week, the health department visited the UWM campus several times and was able to administer over 130 vaccinations. That's the type of numbers we like to see. This week, in addition to offering vaccinations at our Northwest and Southside health centers, the health department will be at the following locations during these times. Tomorrow, which is September 22nd, from 10 a.m. till noon, they'll be at More Than Home. From 1 to 4, they will be at Ascension All Saints Family Health Center. From 1 to 5, they'll be at the UWM Milwaukee Safety Week Fair. And from 3 to 6, they'll be at the Sally Davis Boys and Girls Club. Thursday, they're going to continue working at Boys and Girls Clubs. From 3 to 6, they'll be at the Fraternity Boys and Girls Club. And also from 3 to 6, they'll be at the Milwaukee Academy of Science for Boys and Girls Club. Saturday, they'll be at the El Rey Health Fair from 11 a.m. to 3 p.m. And they'll also be at Cor El Centro from 1 to 4. So a heavy emphasis on the Hispanic community will occur this Saturday. In addition, on Saturday from 10:30 to noon, they'll be at St. Hyacinth Church. So again, the health department is really, really, really getting out there in the community, making these vaccinations available. I did present my 2022 city budget to the Milwaukee Common Council earlier today, and COVID-19 continues to be a big focus moving forward. COVID and its deadly disruption have had huge impacts on our economy, on our healthcare, and I think we all recognize on our daily routines of life. And so our Milwaukee Health Department continues to do an excellent job of managing the complexities of testing, of vaccination, and protection of public health. So many people have stepped up, including Commissioner Kirsten Johnson, Dr. Nick Tamaro, who's been great, and literally dozens and dozens and dozens of health department employees. So you see someone who works for the Milwaukee Health Department, please thank them. The last year and a half have been very, very challenging, not just for them, but for all healthcare workers. So thank a healthcare worker today, even though it's not a special week for them, thank a healthcare worker today. Finally, I would like to share an exciting opportunity in our vaccination efforts. We know the state has been offering a cash incentive beginning Thursday, September 23rd. Milwaukee residents age 12 and up who received their first dose of COVID-19 vaccine at the Northwest or Southside Health Center will also receive a $100 U.S. Bank gift card on site while supplies last. So get a shot, get $100. It's that straightforward. Get a shot, get $100. You can't go wrong. The Pfizer COVID-19 vaccine is available to anyone 12 or older, and the Johnson & Johnson COVID vaccine is available for anyone 18 and up. Anyone under the age of 18 will need to have a parent or guardian present to receive their vaccine and incentive. So more information can be found at milwaukee.gov/COVID-vax or by calling the COVID-19 hotline at 414-286-6800. And with that, I am pleased to turn it over to County Executive David Crowley. Mr. County Executive.
Well, thank you so much, Mayor Baird, and good afternoon to everyone, and thank you for joining us. I want to start off by talking about, as a reminder, one, that vaccines are now required for our Milwaukee County employees. And so employees really have until October 1st to update their proof of vaccination. And so as of yesterday, we had 1,487 employees that have submitted their vaccine verification documentation and 227 employees that have completed exemption forms. And so we know that there are many more vaccinated employees that still need to upload their documentation into the system. And we will continue to offer up to 8 hours of vacation time for those employees who show their proof of vaccination. But to help employees comply with the COVID-19 vaccine mandate by the October 1st deadline, our Office of Emergency Management is hosting a vaccination clinic today until 4 p.m. for county employees at the OEM suite on the 7th floor of the 633 building, which is located at 633 West Wisconsin Avenue. And so walk-in appointments are on a first come, first served basis, and the total time should be less than 30 minutes. But in addition to the vaccine updates, I also want to share some good news regarding our rental assistance that has been provided to many Milwaukee County residents, many who have been financially impacted by the COVID-19 pandemic. And so reports from the housing division show that the division has helped approximately 8,300 households with funding from the Wisconsin Emergency Rental Assistance Program, and really stayed off of nearly 3,800 evictions in this last funding round. So Milwaukee County, we received about 12,140 applications for rental assistance. And of those who have received help, 75% of those households have been African-American, with 78% being women, with nearly half being between the ages of 21 and 35, and 76% in the extreme low income category. And so when we think about this, we have really become a national leader as Milwaukee County in distributing rental assistance, with over $30 million in relief that was provided. And so we are going to continue to work with the state of Wisconsin to secure roughly another $100 million in funding. And this is the ability for us to really assist with rent that is owed, in addition to back rent, to pay that back rent, but also allow the county to really provide urgently needed support to more households throughout our community. And so this funding will continue, but so will the extraordinary need for it as this pandemic continues to impact so many people throughout our community. So the state of Wisconsin has pledged $20 million in funding through September 2022, and additional funds are expected, which will enable us, the county, to really provide eviction prevention support through the 2024 year. And the economic conditions that have been created by this coronavirus pandemic has created a massive crisis in housing stability. And this is an incredible challenge for both staff as well as our partners. And I think we all know that housing security is essential for making sure that we can ensure the health of our community and maintain positive economic and educational outcomes for households throughout Milwaukee County, especially those with minor children. Individuals in need of eviction prevention support should contact community advocates at 414-449-4777. Again, the number to community advocates is 414-449-4777. And lastly, I just want to remind folks that there are only 4 days left to complete the community health needs assessment. And so this is a survey that is distributed every 3 years by Milwaukee's healthcare providers and public health departments as a way to really better understand the needs of our communities, establish health priorities, and really improve programs and services. And so the survey focuses on issues such as access to healthcare, tobacco use, alcohol use, diet, physical activity, cancer prevention, heart health, injury prevention, immunization, children's health, mental health, as well as chronic disease. And it also includes questions about the factors that affect health. And this can include environment, education, trauma, or racism. And surveyors are looking to hear more perspectives, particularly from people of color, as well as households with children. And so if you're interested, this survey is going to be open until Friday, September 24th. And literally it only takes 10 minutes of your time to really complete. And so this is a real opportunity for all Milwaukee County residents to have their voice heard about what is needed to make Milwaukee a healthier place for everyone. So again, for more information and links to this survey in both English and Spanish, please visit the healthymke.com website. Again, thank you all. And with that, I'd like to hand it over to Dr. Weston.
All right, thank you, Mr. County Executive. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 332 new cases per day and about 4 deaths per day. Now that is an increase in both cases and deaths. For cases in particular, both in the county as well as in Wisconsin, after a prolonged period of a plateau in cases, we've seen a fairly pronounced increase over the last week. Now, anytime we're looking at raw case numbers, it's important to tease out the impact that testing may be having. And at the moment, our positivity rates seem flat, but we'll certainly continue to follow that data and pay close attention to our Thursday updates on the dashboard to better gauge the direction that we're trending. Now on to 2 items that are changing the vaccine landscape: boosters and childhood vaccinations. First, boosters. All of the booster news can be confusing and difficult to follow. So here are the cliff notes. First, importantly, all booster discussions at this time are for the Pfizer vaccine only. So we'd expect discussions on Moderna and Johnson & Johnson in the near future. But at this time, this booster discussion only applies to those who received Pfizer. So last Friday, the FDA's advisory panel, it's called the VRB PAC, the Vaccines and Related Biological Products Advisory Committee, it's a mouthful. They voted against booster doses for everyone aged 16 and older. They didn't feel that there was sufficient evidence at that time demonstrating the need for a booster shot for everyone. However, they did vote in favor of booster shots just for those 65 and older, as well as those at high risk for severe disease from COVID. And in an informal poll after their vote, all panel members agreed that those high-risk people should include healthcare workers, as well as first responders. So the next step, the FDA is expected to authorize the booster this week. And then the CDC's advisory panel, that's the ACIP, Advisory Committee on Immunization Practices, they'll also vote on these same recommendations. And that would happen Wednesday or Thursday of this week. So it would be expected that they'll vote in the same way, but not, of course, guaranteed. They would also further define that high-risk group, as well as a timeline for vaccination, whether it's 6 months out from your second shot or 8 months out from your second shot from that second dose. Now, finally, shortly thereafter, potentially as soon as the end of this week, the CDC will make a formal recommendation based on both of these groups voting. So it's a process, but it should be a process. There are so many checks and balances in the process to ensure that these vaccines are safe and effective. So to summarize, what this means is the most likely outcome here is that starting at the end of this week or possibly early next week, booster doses will be made available for those who previously received Pfizer and are either 65 years or older, are healthcare workers, or are first responders. Considering the risk level and the exposure level of these groups, the added boost of immunity will be welcomed and help them to achieve the highest level of protection from COVID. All right, now on to vaccines for younger kids. On Monday, we received news from Pfizer on their work to ensure safety and efficacy of the COVID vaccine for children aged 5 to 11. So using a third of the dose that's used in adults, given in a similar 2-dose series, they were able to induce a similar immune response to that seen in young adults. With about 2,300 participants in the trials, high efficacy was noted, and side effects were minimal and very similar to that in young adults that are already receiving the vaccine. So this is great news. The next step is application to the FDA for authorization, which would be expected by the end of September, that application. The FDA would then review with optimistic authorization on a timeline for the beginning of vaccination by the end, potentially, of October. And there's certainly more data forthcoming, such as detailed specifics on those efficacy numbers, any side effects. This is data that will be released soon for peer review and also provided to the FDA's expert panels for careful consideration before authorization decisions. But this is welcome news to many parents of elementary school children where COVID is without a doubt having a major impact through case rates as well as hospitalizations, not to mention concern for long-term symptoms. So we'll look forward to more details on this important vaccine progress. But in the meantime, we must continue to protect our children with the tools we have, the tools that we know work. So that's masking, distancing, ventilation, and certainly vaccination for anyone who is currently eligible. Finally, I received a few more replies to my posts on Twitter asking people why they received vaccine. At Dahlia SC said that she hates taking medication. She distrusts the pharmaceutical companies, but she said that she read the science herself. She saw the effect that COVID was having, particularly on vulnerable populations. She made her decision, and now she's fully vaccinated. Meanwhile, JJ Moore in Milwaukee is a registered nurse. She's also an Air Force veteran. She said that she received the vaccine to protect herself, as well as her sister, who's immunocompromised. She said that COVID is a universal health crisis, and we're all in this together. I couldn't say it better myself. So please join in. I'd love to hear and share at Ben W. Weston. Why did you get the vaccine? Tell us. I'd love to share it as well. Until then, thank you and stay safe. And I'll hand it to Commissioner Johnson.
Thank you, Dr. Weston. As Mayor Barrett announced, we're excited to launch an incentive program at our Northwest and Southside Health Centers beginning Thursday. Vaccinations are a way out of this pandemic. The data and science show those who are unvaccinated are 4 times more likely to contract COVID-19, 9 times more likely to be hospitalized, and 11 times more likely to die from the virus than those who are fully vaccinated. We hope this incentive will encourage even more Milwaukee residents to prioritize getting their vaccine. There is no better time to get vaccinated. If the public has questions about the incentive program, please feel free to call the COVID hotline at 414-286-6800. As Mayor Barrett mentioned, and as a reminder, the final day of testing in American Family Field is Saturday, September 25th. We are tremendously grateful to the Milwaukee Brewers for providing the space for the health department to conduct mass COVID testing over the past year, and we wish them the best of luck for a successful playoff run. The new testing facility will be announced in the coming days. We are still working through the legal process with the new site and will publicly announce as soon as the contract is finalized. The Milwaukee Health Department is increasing staffing and resources to the Northwest and Southside Health Center test sites in the interim to handle increased demand. All Milwaukee Health Department testing sites administer PCR tests, which can take anywhere between 1 to 3 days for results. So please be sure to plan ahead if you need proof of a negative COVID test. It's imperative to continue to get tested if you experience any symptoms or come in contact with anyone who has tested positive, regardless of your vaccination status. Not only does this help our community stop the spread of the virus, but it helps our lab identify new variants and collect additional data to better understand how it's spreading. As Dr. Weston touched on, we are still awaiting further guidance from the FDA, CDC, and Wisconsin DHS regarding the administration of booster doses. At this time, at the MHD vaccination clinics, those who are moderately to severely immunocompromised, as defined by the CDC, are eligible for an additional COVID-19 vaccine dose. Those additional doses are being administered at our MHD clinics, but we encourage individuals to reach out to their primary healthcare provider first to discuss their eligibility. Thank you.
Thank you, Commissioner Johnson. The first question I'm seeing is from Jeremy Janine with Urban Milwaukee, and perhaps it is for you, Commissioner Johnson. He's wondering, what is the supply of the $100 gift cards, and where does the funding come from?
We have 1,000 $100 gift cards, and the funding came from the COVID testing pilot program.
All right, and Ben Wagner with WISN 12 has a few follow-up questions. He says, does the city have a goal it hopes to hit from the $100 incentive, and either in terms of numbers or percentage of population vaccinated? And does this incentive program only apply to Milwaukee residents, or is it available to everyone?
We really hope it incentivizes 1,000 people to come get vaccinated that maybe weren't going to get vaccinated previously. So it's not a percentage of the population, and it does only apply to Milwaukee residents.
The follow-up question is roughly how many people have gotten vaccinated in Milwaukee County through incentive programs in the past? Not sure if anyone on the call has this answer.
It's a great question. It's one we don't have an answer to. Through the state's vaccination program, that would be a question for the state.
Thank you, Dr. Weston. Mike Spalding with WTMJ AM radio is wondering, for the mayor or health commissioner, do you have a ballpark figure of how many people were using the testing site at American Family Field? And are you confident that the new facility will be able to test the same amount of people?
Yes, so roughly, and this is very ballpark, I can get better figures if you'd like them, is 400 to 500 people a day. And the new facility will absolutely be able to accommodate those numbers and more.
Thank you, Commissioner. Those are all of the questions I'm seeing in the chat. I'll give it just one more minute here. All right. Seeing no more questions, that does conclude today's briefings. Thank you all for joining us, and we'll see you next week.
Thanks, everybody.
Thank you.
Thank you.